Glofitamab is a CD20, CD3 T-cell engaging bispecific antibody that's been in development for a couple of years, and here we've presented the results of the pivotal part of the study exploring its activity in large B-cell lymphoma. 154 patients were treated, and the complete remission rate after exposure to glofitamab was 39.4%. That was achieved in a population that had been treated with 2 prior lines of therapy and were highly refractory. Around 80% of patients included in the study were refractory to their immediate prior therapy. So that's a remarkable complete remission rate. A third of the patients had been treated with CAR T cells, and most of those patients had been completely refractory to CAR T cells as well. And so this was the first time that we'd shown a high complete remission rate in a population that included patients who had been exposed to CAR T cells. And that's important because that's how we treat patients these days. We often have patients who've not responded well to CAR T cells. Glofitamab is an intravenous drug. It's given in 2 step-up doses prior to reaching the target dose of 30 milligrams. We use obinutuzumab as a treatment the week before the first dose of glofitamab, and then glofitamab is given every 3 weeks as a fixed duration treatment. So we give it out to 12 cycles and then stop. And if in the trial, if a patient had responded to glofitamab and then had a relapse, they could be retreated within the trial as well. We showed that that complete remissions achieved with glofitamab are durable. So around 80% of patients at the time that we did the data cut remained in their complete remission at that time. And then we looked across the whole phase 1 study to see whether people have late relapses. And what we found is that these complete remissions were very durable over several years. And in fact, the longest followed patients we've seen have been followed out to 3 and 4 years after being exposed to glofitamab. So I think in those patients for aggressive B-cell lymphomas, we're achieving cures